Hello, everyone. It's December the 30th, and we've got an awful lot to go over with you today. Very unfortunately, since Monday, we've lost an additional 55 West Virginians. I'm going to very respectfully read through them and ask you to keep these people in your prayers, and because I'll promise you these people know it, their families know it, and please just keep them in your prayers because we don't want them to be forgotten, and we surely don't want their loved ones to feel alone. Our 1,264th death, a 90-year-old male from Marshall County. Our 1,265th death, a 74-year-old male from Hancock County. Our 1,266th death, a 71-year-old male from Pendleton County. Our 1,267th death, an 80-year-old male from Greenbrier County. Our 1,268th death, an 86-year-old female from McDowell County. Our 1,269th death, a 62-year-old male from Marshall County. Our 1,270th death, a 67-year-old female from Greenbrier County. Our 1,271st death, an 89-year-old male from Cabell County. Our 1,272nd death, an 84-year-old male from Tucker County. Our 1,273rd death, a 95-year-old male from Monongahela County. Our 1,274th death, a 91-year-old male from Putnam County. Our 1,275th death, an 80-year-old female from Cabell County. Our 1,276th death, an 81-year-old female from Preston County. Our 1,277th death, an 88-year-old female from Greenbrier County. Our 1,278th death, a 91-year-old male from Monongahela County. Our 1,279th death, an 80-year-old female from Hancock County. Our 1,280th death, a 93-year-old female from Wyoming County. Our 1,281st death, a 76-year-old female from Monongahela County. Our 1,282nd death, an 81-year-old female from Berkeley County. Our 1,283rd death, an 85-year-old female from Hancock County. Our 1,284th death, an 81-year-old female from Harrison County. Our 1,285th death, an 87-year-old male from Mason County. Our 1,286th death, a 78-year-old male from Hancock County. Our 1,287th death, a 71-year-old female from Hancock County. Our 1,288th death, a 90-year-old female from Preston County. Our 1,289th death, an 82-year-old female from Cabell County. Our 1,290th death, a 93-year-old male from Ohio County. Our 1,291st death, a 62-year-old female from Hancock County. Our 1,292nd death, a 74-year-old female from Fayette County. Our 1,293rd death, an 88-year-old male from Lewis County. Our 1,294th death, a 77-year-old female from Wyoming County. Our 1,295th death, a 61-year-old female from McDowell County. Our 1,296th death, a 93-year-old male from Preston County. Our 1,297th death, an 81-year-old female from Hancock County. Our 1,298th death, a 71-year-old female from Ohio County. Our 1,299th death, an 81-year-old female from Boone County. Our 1,300th death in the state of West Virginia is an 85-year-old female from Kanawha County. Our 1,301st death is a 72-year-old male from Raleigh County. Our 1,302nd death is a 33-year-old female from Summers County. 33 years old. Wow. Our 1,303rd death, a 92-year-old male from Kanawha County. Our 1,304th death, an 86-year-old female from Brooke County. Our 1,305th death is a 74-year-old female from Kanawha County. Our 1,306th death is an 88-year-old male from Logan County. Our 1,307th death, a 76-year-old male from Logan County. Our 1,308th death is an 81-year-old male from Cabell County. Our 1,309th death, a 79-year-old male from Mercer County. Our 1,310th death, an 81-year-old female from Brooke County. Our 1,311th death is an 82-year-old male from Hardy County. Our 1,312th death, a 52-year-old female from Kanawha County. Our 1,313th death is a 63-year-old male from Kanawha County. Our 1,314th death is a 95-year-old female from Monongahela County. Our 1,315th death is an 84-year-old female from Greenbrier County. Our 1,316th death is a 91-year-old female from Jefferson County. Our 1,317th death is a 91-year-old female from Ohio County. And our 1,318th death is a 46-year-old male from Kanawha County. 1,318 great West Virginians. Please don't forget them. We're going to get through this, but it's been brutal. We lost one of our EMSs, and I believe it's Jason Wooster. He's a paramedic in Putnam County and a firefighter for the Jefferson Volunteer Fire Department. He died yesterday due to COVID-19. This touches all of us, does it not? It touches every single last one of us. Absolutely. Keep them in your prayers. In the last 24 hours, our daily positivity rate is 11.68. It's very high. 1,452 new positive cases. The active cases are 24,433. The recovered cases are 58,474. We have a record high patients in the hospital of 797 and 209 in the ICU units. We tested 11,250 West Virginians yesterday, and we are the second worst in the country in our reproduction number, our RT number, and it's at 1.11. You know, most all of our counties are in the red and the orange. And again, I remind everyone over and over and over that if you are 65 years of age, it doesn't take a rocket scientist to figure it out. You are the target of this killer, and we've got to absolutely address that. Now, we got a lot of news, a lot of news today, and a lot of effort and collaboration between all of our health team, all of our medical experts, all of our education team, all of us within our office and everything, and we've come up with some ideas, and we have vetted that all across the board, and we have perfected it to the very best of all of our abilities, and here's what we're going to do. You know, we have got to get our kids back in school. That's just all there is to it. Across this nation, many states with far worse numbers than we have are finding ways, and within the recommendations of our CDC and our medical teams, here's what we absolutely know. During 2020, we learned that COVID-19 transmission rates in our schools during the first semester was 0.02% among students and 0.3%, which is really basically, let me quantify this, you know, it is, well, there's no point in trying to quantify it, but it is multiples and multiples higher, but it's still very low, but 0.3% among our staff. Now, we know this, that as we go to school, we recommend very sternly that you cannot, the staff, we cannot do stuff like everybody bring a dish and we're going to eat lunch together. You know, we can't do things like that where we're together. We have got to keep the social distancing going and the mask and all that, because the staff is phenomenally higher than anything to do with the kids or anything like that. You know, we've learned that when we switched learning modes, the outcome, and switched to the virtual learning and all that, we've tried really, really hard, but we all know across the board that we're failing in that. We're absolutely failing. Now just imagine this. In the first semester, and this is coming directly out of the Department of Ed, in the first semester, 1/3 of our students, 1/3 of our students are receiving failing grades in at least one of their core classes. Failing grades in at least one of their core classes, 1/3 of them. The virtual learning models do not work for most students without consistent live engagement from a teacher, from a student's own school. The DHHR reports that there is a reduction in child protective services referrals by an average of 50 to 54% per month. Now, what that basically means is this. For the kids that bad things are happening to kids. Stuff that's happening, you know, that's just unheard of. It's just terrible. We're not even getting it reported now. We're not even getting the reports. And so, absolutely, we got a bunch of kids that are out there really, really suffering and bad things happening. You know, so therefore, if we review real quickly, the schools are safe. The transmission rate we know among our students that are age 15 and above is significantly higher than our kids that are below 15. So what we're doing today, I am announcing that all West Virginia elementary and middle schools will reopen to in-person learning on Tuesday, January the 19th. And this gives our county boards of education, our teachers, our staff, and students a little more than 2 weeks to prepare. We're taking that 2 weeks because we need the time to get ready. For all the high schools, we'll continue to use our map, and we are continuing through the weekend to work on the possibilities of tweaking our map to just some degrees. From the standpoint of one of the tweaks that we're going to do is we're going to offer back in-school learning in all of the counties that are in the orange. We're going to continue through the weekend to look at that map because these are the kids that the transmission rate is surely higher than our much younger kids. Honestly, our much younger kids are so much safer at our schools. And our teachers and our service personnel, to be perfectly honest, other than being at your house, are really safe at our schools. But to make this one step more, you know, all of our high schools will continue to will not go to school. In the red, they'll be following the map, but they will go in the orange. And we're targeting March 1st now to be a startup, and I hate this like crazy, but we're going to have to move our winter sports to March 1st. So that will be the startup date. We all know our schools are the pillars of our communities, and we absolutely all know that we've got to do more and more and more to make them safe. So therefore, today I am also announcing that we are committing to offer vaccines to all teachers and all staff and all service personnel immediately of anybody that is over the age of 50. And we're going to accomplish this in the next 2 to 3 weeks. We're going to offer the vaccines to anybody over the age of 50 that is a teacher or service personnel or people that are at our schools. We will then double back After we accomplish that, we will double back and we will go back and get everyone at our schools under the age of 50. Not our kids, I'm talking about our teachers and our service personnel. And all the information on where and when you will receive the vaccine will be distributed throughout the Department of Ed directly through the superintendents in the counties. Now, the other thing you must know is just this. We're still going to let the local control rule the day. All I am telling you today is we're recommending absolutely that on January the 19th, we're going back to school on all of our middle and elementary schools. And on January 19th, we're going back to school on our higher ed on all counties that are not in the red. Now, in addition to this, in hearing the cries, and just to make sure, that I may have said higher ed there, but I'm really referring, we are going back to school on January 19th in our middle schools and elementary schools statewide. We are going back to school in our grades 9 through 12, high school grades 9 through 12, statewide if you're not in the red. Now, teachers, I urge every last one of you to take real advantage of this and go get the vaccines when they're available to you. Service personnel, same thing. We're going to naturally go first and foremost to everybody 50 and above, and we're going to go through this really, really fast. There's been a lot of work going on in the last 2 or 3 days and everything to be able to, accomplish just this. And through our health departments and National Guard and everything, I think that we can carry out my directive here and we can get this done. Now, in addition to that, we hear the cries all over the place with the fact that the simple thing, you've heard me over and over, you've heard the questions from our media, the great questions that have come up in regard to our seniors. You've heard me over and over say, this really boils down to age primarily. You've also heard, concerns from our seniors like, well, dag, if we do all the testing to all the people that are working on the front lines, whether they be first responders or all the acute care people and everything, the hospitals and everything. We went to all the nursing homes and assisted living and everything, but I'm a senior. I'm someone that's above the age of 80. And I'm sitting at home and I'm scared to death. I'm absolutely scared to death. Because basically you're telling me that, by the time you get to me, it'll be springtime. Or it may even be later than that. And yet, I, as your governor, am telling you every day that this thing is all about age. So we're pivoting again. And today, I am announcing that we will begin vaccinations today to the general population that is in excess of 80 years of age. Doses are being delivered as we speak to 82 organizations, including primary care physicians, health clinics, and local health departments that are designated for those 80 and older. And vaccinations will begin as soon as today. But in addition to that, and where all this information will be up on our website and everything, and you'll be able to see this, and we'll be, but in addition to that, we are planning now to hold several vaccination events for West Virginians that are 80 and older at our National Guard armories or other selected sites around the state. We will announce those times and locations as soon as they are finalized. These events will have to be on a first-come, first-served basis. Understand loud and clear that we believe, I surely believe with all my soul, that if the faster that we can get shots in arms of people, especially that are of a significant age, the more lives we're going to save. This is boiling down to minutes, not days, minutes. And the faster that we can get those shots in the arms of the 80-year-old plus, then we'll double right back and we'll get to 70-year-old plus. Then we'll double back and we'll get to 60-year-old plus. We have got to do it with the resources that we have. Now, that doesn't mean the manpower, or that doesn't mean somebody's punching in stuff on a computer. That doesn't mean somebody's administering the shots. It means all that, but it really doesn't mean that. What it really means is just this. We can't give out 50,000 doses of vaccines if all we got is 10,000. We're only going to be able to give doses on a first-come, first-served basis to the number that we have at those locations. We cannot do more than what we have. We cannot do more than what we have, but we can get them out fast, and we can get them to the people that need them the most, and absolutely, then we can cry to the mountaintops to get more, to get more. The faster we get them out, the more we cry, and the more we'll get here. Next week, we will be at multiple, National Guard armories, and by multiple, I mean 3 or 4 probably. In addition to that, we have vaccine going today to 82 different organizations across our state for just the elderly, for people that are in excess of 80 years of age. And in addition to that, though, what we will be doing, we will have those vaccination locations to where you can have someone drive you there. We will get you through in an assembly line basis as fast as we possibly can. We'll get you through safely and everything, and we'll get you through and get your vaccination, and we'll get you logged in, and then you'll have to come back in either 21 days or 28 days and get your follow-up shot. From the standpoint of vaccination distribution, West Virginia is still leading the way, but we're not going to be leading the way long. We're not going to be leading the way long because what's going to happen is other states are beginning to get their act together, but now we're taking another leap forward that no one will be able to imagine. West Virginia, again, leading the way and coming up with an idea of how to, right now get this, right now, we're leading the nation because we have put shots in arms of 43% of the vaccines that we've gotten. It's not good enough to me. Any way you cut it, no matter how hard we're trying, it's not good enough. That's all there is to it. So in other words, we've gotten in, we have the number of vaccines that we've gotten in, 43% of them are in somebody's arm right now. 47% of them, or 57% of them rather, are going around and they're getting positioned through our state, but they're not in somebody's arm. So what we really need to do is we really need to target these seniors, especially the people that are above 80 years of age, and absolutely we will save lives today. Today, we will save lives by doing this. We will not be taking from one pot to ensure that we're able to do this. We will not be delaying or pulling, robbing Peter to pay Paul. We will not be doing that. But absolutely, our great guard and everything, when we came up with this idea, I asked them to go to work on it. They have poured it on, and they've come back. We've tweaked, and I've asked them again. I said, that's not good enough, and we tweaked, and now we've got a plan that is, I think, a terrific plan. The closest state to West Virginia is Colorado now, and they're at 30%, and we're at 43%. It's not good. It's no good in my book. If West Virginia was at 85.6%, yeah, really good. Really, really good. Because if you've sent out if you've got in people's arms 85% of your vaccines that you've got, just think how effective that I'll be screaming at the federal government that we got to have more right now. What if, let me be ridiculous to make my point, what if I were Illinois and I had put out 3%? Well, the federal government's going to look back at me and say, well, Justice, if all you've got out is 3%, you've got them jammed in the warehouses everywhere in the sun. We're not going to send you more. We're going to send them to West Virginia. That's what we want. That's exactly what we want to have happen. The entire plan from day one has been based on decreasing hospitalizations, decreasing deaths. 1, 2. 3 is protecting the most vulnerable and ensuring our state can keep the critical care services available to all of us. Now let's just think. Decreasing hospitalizations. We've got to keep our hospitals able to take us if we have a real problem. This will do that. Decreasing deaths, no question. It'll do it. Providing care for the most vulnerable. Well, who in the world is the most vulnerable? It's absolutely the ones that are old. And so with all that being said, we're going to get after it, and we're going to get after it. I mean, we're going to really get after it. The long-term care vaccination, West Virginia is leading the nation in absolutely getting our vaccinations to our nursing homes and our assisted living. We are the first in the country to finish vaccinating all our long-term care facilities. All 214 facilities in our state were completed by this morning. It's amazing. It's really great stuff. And as we now move to vaccinate our teachers and staff and those in the general population over 80 years of age, we are doing so. So having, already completed vaccinating our long-term care facilities and making huge headway on all of our healthcare workers and frontline workers. We're ahead of every state, and not only do I want us to be ahead, but I want us to lap the field. Because every time we're lapping the field, we're saving somebody's life. This isn't absolutely just lapping the field. This is saving lives. And that is exactly what our job needs to be. Just a reminder again about the vaccines. Take the vaccine, for crying out loud. People say, you're going to grow a third arm, you're going to grow antlers. I mean, give me a break. I mean, for crying out loud, take the vaccine. Every day you see me read name after name after name of people that were gasping for breath with their loved ones not even able to be there, gasping for breath and died. You got to take this vaccine. Now, I've got some other announcements. This is good stuff, but, as far as our higher ed, Chancellor Tucker and all of us met, and we met on Monday, and so we are announcing now that we have the monies available, and we're going to test, as we did in the fall, everyone that comes back to school, all the students, all the faculty and everything as they come back after the Christmas break. We had great success in doing so. Then we want to be able to find a way to test everyone on a weekly basis. I don't know that we're going to be able to do that from the standpoint of just the logistics or the cost. We are working this as hard as we possibly can. We have the money set aside to be able to test everybody coming back. As a result of the weekly testing in the fall, our colleges and universities saw a cumulative positivity number. Remember, we wanted it to be under 3%. Our colleges and universities had a cumulative number in the last go-round of 1.9%. It was really good, really good. So, I commend all the great work that's going on there. We will continue to do surveillance testing, and we will continue to try to source, tests that could very well come to us at a cost of, the Binex test, at a cost of $5. But really and truly, the test that we're having to go with right now is over 100 or right at 100. And but we're working it. We're working it as hard as we possibly can. I told Chancellor Tucker and everybody else, We are to mind the store. We're to save every dollar we possibly can. We're not to just kick back and say, well, we'll just use the $100 test, and we're not going to do that. We're going to work this and work it and work it, and absolutely in every way to try to save every dollar we can possibly save. Saving a dollar creates a dollar, and that's all there is to it, and creates a dollar for higher ed or whatever it may be. Okay, the antibody stuff, I've been through this over and over, but if you're over 65 years of age, or 50 maybe, but if you're over 65 especially, and you've got a sniffle, or you've got a cough, or you've got a headache, or you're just feeling tired or whatever, please, for God's sakes, a living, go get tested. We can give you antibodies that will absolutely probably save your life. Just remember that and go get tested. As far as our testing, and free testing map and drive-through pharmacy, you see it, it's everywhere. All you got to do is just follow that and everything and go with it. Our school outbreaks, we're down now to 35 confirmed cases in the public school system, 9 outbreaks. We've said it over and over. Naturally, with anything and everything, when you're dealing with a pandemic, there's risk. I mean, come on. I can't go and bubble wrap every West Virginian. But if I bubble wrap you and I keep your head out of the bubble wrap to where you can breathe and eat and drink, you still have an opportunity and a chance to get this terrible disease. I can't make it risk-free, but we do know from all the data that our younger kids are suffering beyond belief by not being in school. Our older kids too, but our younger kids, the chances of us transmitting this is very, very minuscule. Our long-term care facilities, we have 120 outbreaks now, with 16 outbreaks in our churches in 13 counties. That's Greenbrier, Harrison, Jackson, Marion, McDowell, Mineral, Mingo, Monongahela, Nicholas, Raleigh, Summers, Upshur, and Wyoming counties. You've heard my spiel over and over. For right now, if you've got the opportunity and vaccine is on the way to people 80 plus, then we're going to fall right back to 70, fall right back to 60. We're getting closer and closer and closer to being able to vaccinate you. Absolutely, that the churches are an area where we can have significant outbreaks. You've got to protect yourself everywhere. Use your head. Wear your mask. Keep your social distancing going. Wash your hands. Do all those things you got to do. A corrections update. Corrections has gone way, way up. We now have 634 inmate cases. We have 268 of those cases at our Eastern Regional Jail. 247 at St. Mary's. 65, inmates have recovered so far at St. Mary's. We have 57 at Tigard Valley and 55 at the Central Regional Jail, and there are 46 staff cases throughout that. Odds are overwhelmingly that what is happening here is either through some level of contact with people coming in from the outside, especially staff. People are bringing this asymptomatically right into our prisons and our corrections facilities, and then we have an issue. However, if you step back from this and just think just a second, we have had 5 people in corrections die. It's an incredible job. Keep up the great work. Keep up the great work, please. We have, and one other note that they just, flashed up to me is we have begun the vaccinating of our staff at corrections, and we'll continue to do that till we get them all. Unfortunately, and I say this across the board, and I don't get it. I just plain don't get it. But unfortunately, what we're experiencing with the staff at corrections is about a 60% cross-section of those in staff are taking the vaccine. That's not going to cut it. It's just not going to cut it. And so we really, really need to watch that, and I would highly encourage people to rethink that and take this vaccine. You know where we stand on all of our wearing of our face coverings and so on like that. It is mandatory that you do so at times that you're out in a public building. Absolutely, you should do that to protect everyone. If you agree or disagree, crying out loud, wear your mask. Wear your mask. I mean, what in the world does it hurt? What does it hurt? You know, why in the world do you need to be on a soapbox today? You don't. What does it hurt? And if you've got some breathing issue or whatever, that's not what I'm talking about. What I'm talking about is the people that are standing on the sidelines, and there are only a few. Thank God there's only a few. But people are standing on the sidelines saying, well, that's my right. I'm not going to wear that mask. Well, it's not your right. It's absolutely not. You need to wear your mask for everybody. The flu vaccine is available and it's out there. You ought to be taking it. We ought to be trying to give blood and plasma if you can. Now, I've got a couple other announcements real quick, or just one, or two, I'm sorry. And that's just this. There's a lot of really, really good people that have been working on this project for a long time. You know, like I said, you know, whether it be, you know, Gordon Gee or Steve Farmer, you know, I talked a whole bunch to Steve, you know, just all the different people, you know, that have absolutely put in the licks, you know, and Mark Nesselrode, and, you know, just so many different people that have absolutely come to me and talked a lot about this. They needed $3.5 million in dollars we had available in the CARES money. And today I am announcing that we are allocating $3.5 million of CARES money to WVU Medicine in connection with the Morgantown Community Resources Ramada Inn project. These funds will be used to replace the roof, install a new HVAC system, install additional sprinkling, renovate the commercial kitchen, update the elevators, and renovate the remainder of the former Ramada Inn so it can house and accommodate many different social service agencies. This is what we need. We've got a lot of people that are out there really, really hurting. We've got the dollars to do this. We're going to do it. And the organizers of this project include the likes of Steve Farmer, Mark Nesselrode, Gordon Gee, Ron Justice, David Goldberg, Kara, and I hope this is Veltri, Mike Sabe, Michael Mills, and Jamie Ridgway. And I'm sure there's a bunch of others. And this facility will serve as a centralized and coordinated base for social service agencies in the Morgantown area to help reduce the spread of COVID and its negative impacts among our community's most vulnerable populations. It's great stuff, guys and ladies. You did good work here, and we hope and pray that this is going to do a lot of good stuff for a lot of people that are out there, great West Virginians that are hurting. The only last thing I've got is just this, is with all the stuff that we are doing right now, there's tons and tons that we're trying to perfect as far as where we're going to be able to go, to which National Guard armories, how many vaccines do we have available, you know, what are we going to do in regard to, you know, tweaking our map for our 9 through 12th graders. There's so many other things that we're continuing to perfect and work on that we're not going to have another briefing until Monday. And the reason for that is just simple as mud. And that is just this. If we come in, you know, press ask a whole lot of questions. We're just incomplete with our work and everything. But we are putting a stake in the sand again as great West Virginians today to help our kids get back in school, to protect our teachers and our service personnel and put them at the head of the food chain as far as getting them vaccinated. To absolutely, there's four things. We're putting a stake in the sand today to get our kids back in school. We know how bad our kids are hurting. A third of them are failing at least one of their core classes. A third of them. We know the virtual concept is the next best thing we got, but it's absolutely not working nearly like what in-school learning is all about. We know how difficult it is, for daycare and everything on our families, from the standpoint of what are you going to do with the kids. We know how much of an impact that has on our economy. And then it only gets worse. What are you going to do about all the special needs kids? What are you going to do about all the kids that are out there that are bad things happening to them, maybe in the homes or wherever it may be, bad things, and they're not even reported? What are you going to do about all those that are just falling through the cracks everywhere? It's really sad. So we're going to do number one, we're going to get ourselves back in school to our younger kids. And we're going to do the very best we can to get our 9th through 12th graders back in school. Number two, we're going to defer the winter sports until March the 1st, and hope and pray we're off and running March the 1st. And we got a long runway in front of us from the standpoint of got still a lot of time left in the school year to be able to play and have the sports and with all that and everything else is just think of the numbers that we will have vaccinated at that time. Absolutely, we're very hopeful that this thing is going to turn and we can absolutely go to where we can have sports indoors and everything, and we can do that starting March the 1st. The next thing is just this. We don't want to get caught in a situation to where we've got vaccines that are sitting in a warehouse, do we? Of course not. We got to get those vaccines in people's arms, and we got to get them in arms really fast. And we absolutely need to protect, if we're going to be in school and everything, we need to absolutely move up the food chain, our teachers and our service personnel, and we're going to start with everybody above 50, and we're going to get them vaccinated, and we're going to get it done in the next 2 weeks and days. Absolutely, we're going to get that done now, right this minute. And then on top of all that, the last thing in this thing we're going to do is, which I would say is the fourth thing, and that is we're going to make a renewed super commitment to our super elderly. Today, we'll save lives today. Today, if we'll have some of the elderly above 80 come in today, we'll save their life today. And every day that goes forward, we'll save more and more and more lives. So at the end of the day, today is an announcement from me that probably is as significant as any day that I've ever been in front of you. First of all, we're going to go back to school. Second of all, we're going to defer our winter sports. Third of all, we're going to absolutely be able to vaccinate our teachers and our service personnel and all those that are attached to those schools. And fourthly, we're going to make a real life commitment to taking care of and getting shots in the arms of our elderly. And lastly, which is really a total of 5, lastly, we're not going to get in a situation where we've got a bunch of vaccines that are sitting in a pharmacy or sitting in a warehouse or sitting somewhere when today they need to be in somebody's arm. And if they're in somebody's arm, then I'm on the phone screaming like crazy to DC and everything else. And instead of your allotments going down, I'm very hopeful that they're going to go up. That's all I got today.
All right, thank you, Governor. Let's now hear from Clayton Birch, West Virginia Superintendent of Schools.
Thank you, Jordan. Governor, on behalf of the teachers, the superintendents, the state board, this is a day too that we think is just as important that you've announced at any time during the pandemic. Folks are going to ask right out of the gates, why now? And we use the map all during the fall, and the answer is quite simple. We know more now about this virus and about schools than we knew in March when we shut down. We know more now about this virus and how it reacts and how our schools can mitigate it than we did in August or September. And the team that's around here that I know is joining us today, everybody from Secretary Crouch to Dr. Marsh, Dr. Amjad, General Hoyer, and the governor himself. The team is amazing at always keeping our children in the forefront. And we've never lost sight, and not one time did we lose sight that as we move down this path, that our children needed to be the focus. From agreeing and knowing from the day one we were going to feed them each and every day, options for families, making it safe. But we can stand here now, I'm sure we'll hear from Dr. Marsh in a bit more on the safety of returning in school. We know a lot, not only from national and international data, but we know a lot here in West Virginia about what's working. You heard the governor mention the infection rates in the schools, the transmission rates. I think we average for an outbreak around 4. We do a really, really good job in our schools of mitigating that. But a few things that I just want to clarify, and it'll sound a little bit like I'm repeating the governor, and that is this January 4th through the 15th, we have a 2-week period we've been given to really prepare for January 19th. And during that 2-week period, we have a lot of things happening. First and foremost, I'm so appreciative that we're going to see the vaccine rolling out to all of our 50 and above teachers, service personnel. But also during this 2-week time, I want the public to realize we're not losing sight that it's not about schools being closed. Schools are open. We're coming back on the 4th. We're going to be in a remote learning plan. We're going to continue engaging our students, preparing the families for that January 19th date. And we're also not going to lose sight that we're going to continue feeding children during this time. We are not going to drop the ball at all. Secondly, we're going to really come out of this and double down on our mitigation strategies. I'll be meeting with the superintendents later today. We'll be carrying this message from the governor and the health experts here and the entire team. But coming back to school, we know a few things. We know that there are key mitigation strategies. If we all follow them, we know schools are safe. It's when we don't follow the strategies that we've seen outbreaks or transmission in a school. And they're really quite simple. They're things we've heard the governor, Dr. Marsh, our health officials say from day one. We're going to wear masks consistently, properly at all times. We're going to continue washing our hands and practicing proper hygiene. We're going to social distance to the extent possible. We're going to eliminate large gatherings, which we've been doing in our schools. We're going to continue cleaning and disinfecting. And we're going to continue working with our local health departments for that contact tracing when it needs to be done. Continue the mitigation strategies. Our schools are safe. Our children need us. I'm so appreciative that we got to mention that it's not just the academic challenges we're facing. Thank you, Bill Crouch, and everybody else who's brought it to light that our Child Protective Service numbers are really, really down. We don't have eyes on children. Our biggest fear is that any children fall off the grid. We can't allow that to happen. There is no substitution for a teacher engaging these students in person. Our students need their teachers. I had a chance to travel right before the holiday, and every single teacher, every single county personnel, and every single superintendent echoed exactly what we heard today. We've got to get our children back in school. They need that option. The options are still going to be there for families, though. Those that choose to remain on virtual, we're not taking that option away. But we are going to open up our schools, and I'm so thankful, and I look forward to it. Thank you.
All right, thank you, Superintendent. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. It's been a busy couple days, as the governor pointed out. We've worked late into the last couple of evenings, and we have a lot of work to do over the weekend. As the governor laid out in the conversations we had with him directly over the last couple of evenings goes back to that conversation he's had with the Guard and with all of us before about triple it and then triple the triple. And the discussion of last night was if we're going to take care of the people of West Virginia, and we've been bold at it, but we've got to be bolder than we've been before. So that means that over the next several days, as he continues to press us, and we move out this bold initiative, We are going to be looking at distributing to 44 counties to get teachers started next week for those over 50 with vaccinations. That, as the governor pointed out, we will be identifying a couple of key locations to start larger scale vaccinations that we will be distributing to FQHCs and other assets to get into the arms of our 80 plus population, which we know are our most vulnerable. So as somebody who's got a mother who is over 80 and an aunt still around who's over 80, Governor, I appreciate you pressing us again to be bold, and we will continue to press and move forward as hard as we can, and we'll follow that adage of John Wooden of being quick but don't hurry and make mistakes. And again, this is a bold effort, and it is going to take a lot of work by a lot of people, but we owe it to the people of West Virginia to press forward. Thank you.
All right, thank you, General. Next to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. We have a lot to talk about today. The governor has made some very important decisions, and as the leader of our state, we thank him for that. I want to start off and talk about people that have received a vaccine already. We're coming up upon the week that the first vaccine delivery to people will be coming up for the Pfizer vaccine for the second shot. So we know that the vaccine is really only maximally effective if you get 2 shots. And we've said before, don't mix and match the shots. If you got a Pfizer vaccine to begin with, you got to get a Pfizer vaccine. And the time to get that will start next week for the immediately early people that got vaccinated. The profile of the second shot may produce a little bit more soreness in the arm, or a little bit more of feeling kind of like blahs for a day or so. But in general, the profile should be well within the kind of a flu shot with maybe a little bit flu shot plus kind of arm soreness. And it's so important that each person that got the first vaccine get the second vaccine so that you really do get that optimal protection. And as the governor said, for the Pfizer vaccine and for the Moderna vaccine, the effectiveness is about 95% trials. So get your second vaccine. Let's talk for a second about the about school openings. I think this is a really important and absolutely correct decision the governor's made based on all of the data that we know around the world, in our country, and also in West Virginia. So a big study just came out from Iceland that was probably one of the best done studies, looking at about 40,000 people. And what they found was that the children under 15 years old were half as likely to contract COVID as people that were older, and half as likely to transmit that. And that's really important as we look at the age ranges that we're starting to think about to reinstitute in-person learning opportunities for our middle schoolers and our elementary school children. And as Superintendent Birch, and we really appreciate his leadership on this, has told us many times, that we see significant reductions in growth academically and educationally in children that are in online only learning opportunities. And that's not because of anybody's fault. It's just what happens. And moreover, we know that the essential services, the child protective services, the health services, the structure, the love, the support that children get in the classroom is really important. And for teachers, I know that many teachers may feel vulnerable in classrooms, but what we found is, and as opposed to maybe what we thought when we first started this whole experience with COVID-19, that if we can follow simple strategies like wearing masks and staying distance in classrooms, that in classroom is actually much safer than in a community. And the outbreaks that we've seen in the schools are almost all outbreaks from communities, people that have gotten infected in their community actions and activities and brought those infections into the school and transmitted those, say, from teacher to teacher in a meeting, in a potluck lunch, and or between staff in a school bus garage, or among students on sports teams where people are not effectively wearing their masks. It's really important also to recognize that a really big study just came out from India. And this is really important, not just for the schools, but really for all West Virginians, is that a commitment to mask wearing has happened in India. And India is our most populous per square mile country with China, had been suffering more and more COVID-19 transmission. And in fact, the projection was it was going to exceed the United States very quickly. But India, the populace really has embraced mask wearing to where over 95% of the people of India wear masks. And India is a place you can't separate. So there's no physical distancing. This is just mask wearing. And they've reduced their number of cases down to 25% of what their projection was. So they reduced their cases by 3/4 by wearing masks. And as we look at West Virginia and we look at getting vaccines in the most vulnerable people, including our educators, because we know that, again, if we look at that group of people who've died in West Virginia and we look at 50 and above to protect them, then we cover 97% of the ages of those people that have died in West Virginia. As the governor has said, we are very proud that today we finished immunizing all of our nursing home residents, which account for about 50% of all of our deaths. And as we look at our vulnerable teachers, we want to get vaccines in their arms as quickly as we can. And as we are going back into the school environment. And as we look at older children, our high school children, we know that they will also benefit from being in school. And we know that the transmission in the classroom when you're wearing masks and staying distance is also very low in our high school age children. But we also know that over 15 years old, that the ability to transmit the virus does change. So really being very careful. I think the governor has made that decision about having the less than 15-year-olds back in in-person class and the over 15-year-olds really relying on some additional guidance, including community spread. So I think that as we go forward and we start to look at our plan, we are not changing the plan that we have followed the governor's guidance. As we've said, this plan is not sequential, it's overlapping. And so as we target these vulnerable teachers and other critical workers and other healthcare workers in our phase 1C and 1D, we want to immediately also start to direct vaccines against, as the governor has said, our most vulnerable population, the people that are the oldest. And by the CDC's data, again, people over 75 years old are 220 times as likely to die of COVID-19 than 18 to 29-year-olds, are 8 times as likely to be in the hospital, and people over 85 are 630 times as likely to die from COVID-19 as an 18 to 19-year-old cohort group, and 13 times as likely to be in the hospital. So as we look at our hospitals, and we worry about the numbers of people in our hospitals today, as the governor pointed out, then we know one of the things we can do to reduce the stress on our hospitals and to save lives is to put vaccines in the arms of our most vulnerable population, our over 80-year-olds, get those people vaccinated and then move down to our 70 to 80-year-old group. And so as we move forward, we know that a critical issue for us as we look to save lives is to maintain that vital hospital capacity and function. And today we are as full, more full in our hospitals than we've been at any other time during the COVID pandemic. And that is a cause for concern for us, not panic, but concern. And so we are very rapidly and consistently working with our hospital leadership to make sure that we are doing everything we can to support them and provide that capacity for every West Virginian who needs to be treated. But it's really important that you hear this. So each person who's listening to this, each citizen of West Virginia needs to contribute to providing that capacity and making sure that we, in this next month, thrive as a state by wearing your mask and staying distance. Wearing your mask does work. And if we do this consistently and follow all the guidance the governor has given us and that we've said over and over again, West Virginia will continue to be a beacon for this country. Thank you so much.
Thank you, Dr. Marsh. Dr. Ryan Amjad and Secretary Crouch are also joining us today. Before we go to media questions, we'll go back to the governor for just a moment.
Okay, I just want to clarify one thing. For all those that are over 80, listen up really close to me. The federally qualified health clinics will be reaching out to you when they receive their vaccines, when they've got the vaccines in hand. And if you want to reach out first, contact your health clinic. Watch for our sites. You've got to watch for where we're going to be, because next week we'll be at National Guard Armories. We'll be pumping that out over the weekend as to where we're going to be. And absolutely, you can go to your health clinic if they have the vaccines. And if they don't have the vaccine and everything, and you can make it to one of the National Guard Armories or have someone bring you or whatever like that we have these vaccines there, we will vaccinate all that we have available to us there. Now, you got to understand this, and everybody understand loud and clear. I am saying this over and over and over. Without any question, this is bold and aggressive, but we have people that are dying, and we know we're going to save lives, period. We know we're going to save significant lives. Now, with that being said, we also have got to know this. We can't give you vaccines we don't have. So when it really boils right down to it, I don't want the vaccines sitting on the shelf. I want the vaccines in people's arms, but we can only give you what we've got. And so there's a limited supply, and when we run out, and we'll get more. And then we'll come back, and we'll get more, and we'll keep coming back. So there may be some level of inconvenience and disruption and everything. That's just part of what it is. We cannot give you vaccines we don't have. But that's for everybody above 80, please contact, if you choose to do so, either you'll be contacted directly or you can contact your health clinics, and if that doesn't work, watch on our website. And when our National Guard facilities say that they're going to be there, and you can get there easier or make that happen some way, do that.
All right, thank you, Governor. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question, Governor. Happy New Year. I know that you've answered a lot of questions and provided a lot of information, but as soon as you say something, as you well know, that just turns over another rock. So let me ask you a couple of things very quickly.
Kenny, we seem to have lost your connection. Are you still there? Well, we'll have to come back to Kenny. Let's go next to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams of Ogden Newspapers here. Obviously, I've asked this the last couple times in regards to when we plan to move older people up, and obviously you provided a lot of information about that today. What precipitated this? I mean, the obvious, we can point to the obvious being that obviously they're most risk, particularly to people in the 80 to 89 age range, because they're disproportionately affected. They make up a small percentage of the state population, but make up an overwhelming percentage of the COVID-19 deaths. So that's an obvious reason, but I kind of wanted to get into your thinking over the last couple of days of why you all decided to go ahead and move them up after all. Thank you.
Well, Stephen, let me just say just this. You know, I go back to the very beginning days. And people said, boy, you know, gosh, it must be awful being the governor to have to go through this and all this kind of stuff. And I said, and I meant it, you know, I truly believe without any question that God put me in this position to handle this. I've done a lot of stuff, and it's an honor to be able to handle it to the very best of my abilities. And I pray every day, multiple times a day, that I'm pushing the right buttons and doing the right things. Now, with all that being said, the reality is just this simple. Our National Guard and our health community has gotten out 43% of the number of doses that we've gotten. And all of us know that that is leading the nation in the number of doses that we have out there. And all of us know that the number one people that really and truly need this and could save the most lives tomorrow is if we just laid everything down and said, we're just going age, and we're going to lay everything down, and that's what we're going to do. Now, we know that. And we know that our Guard and our DHHR and all the people have sent out 43% best in the nation. But with that, we know too that there's 57% of vaccines that are in our hands right now, and there's people screaming out there because they're dying. They're dying. And so blame this on anybody or give credit to anybody, but this is my vision. This is my decision. I'm the one that called everybody together and said, by God, it's not good enough. Here's what we're going to do. We got to get our kids in school. We got to get our teachers and everything vaccinated. And give me a plan that we can do this and really jump right in on our seniors now. Right now. Well, we are already doing so much good work. We don't want to be critical in any way of the work because the work is phenomenal, leading the nation. But who cares? Who cares? I mean, we're leading the nation. You know, let's lap the nation. I mean, we know without any question, Jim Justice just read 55 more names. And we know without any question in the next hour that if we wait an hour, somebody is going to die because we waited. It doesn't matter to me. It's not a matter of constructing a great big program and everything. We got to have the program. We got to do everything the right way, and we're going to do that, but we have got to crank it. That's just all there is to it. And so, for good or for bad, this one's on me. To me, to where I am, I feel the pain of our kids that are absolutely failing in grades, absolutely being abused, absolutely all the different problems that are happening with our kids in special ed or whatever it may be. I know and I feel that pain because I'm in the schools. I know the pain of what it's going to be to our teams to not be able to participate in winter sports for a while. I know. And I know the fact that people are dropping like flies and they're the elderly, and we got to get there. Now, to me, it's just a matter of just simply just this. I don't care that we're doing great. I want us to do better than great. More and more and more we can do, and we can do more. We've got the greatest people in the world. Our National Guard is out of sight. The people in DHHR and these health experts here are so brilliant, it's unbelievable. Our education community led by Clayton Birch, absolutely terrific. Miller Hall, what an incredible resource and board president. There is so many resources that we have in this great, smart state. But absolutely, I'm going to keep my foot right on the gas until we get there. And we got too many people dying now. We got to do more. So this one's on me.
All right, thank you, Stephen. Kenny, do we have you reconnected?
I certainly hope so. You got me?
We do.
Thank you. Leave it to 2020 to take one last shot at us before we get out of here. But the question for the governor, Governor, you said that you're going to leave local control to schools. Is your back to school announcement today an order or a recommendation? Do they have to go back to school, or can counties still have local control, as you said? And then very quickly, I know you've backed up winter sports to March 1st. A quick check shows me that the first official day of spring will be March 20th. So I know you've just gotten winter sports taken care of, but do you have any idea if and when we're going to have spring sports in West Virginia this year? Thank you, sir.
Kenny, jumping to the latter question, I really don't. You know, some way, somehow, I truly believe that Bernie Dolan and the SSAC and all the great work from the Department of Ed and everything, they'll figure it out. You know, it may be abbreviated, you know, but right now it's simple as mud. I mean, we can't go into gymnasiums. We can't bring people in, you know, parents and whatever, to watch games and all that kind of stuff with what we got going on today. We're on the brink right now of vaccine to be able to really vaccinate a ton of our people and everything, and maybe cripple this cycle that we're in and everything. But you know, I'm positive now that we have got to push out our winter sports, and then we'll deal with that as we get there. As far as having the authority to be able to demand that the people go back to school, I don't know that I've got that authority, but I don't really want to have that authority. I want the people that are in command at the local level to make those ultimate decisions and everything. But I want everyone to know that I am all on board, and I think our kids, middle school and under, without question, need to be in school. That's all there is to it. And I think that moving boldly this way to vaccinate our teachers and all those that are working in our school and our service personnel and everything will absolutely underline and will make another layer of safety beyond belief for our teachers, our service personnel, and all the kids and everything else. We know it's already really safe, but we're trying to just make it absolutely safer. So with all that being said, you know, I don't want the authority to absolutely make the ultimate decision, but I absolutely want the ball to be able to say, I think we ought to be in school. Everybody should be in school, in middle school and elementary school, because the evidence and the science tells us without doubt, go to school. And absolutely all you got to do is look in the eyes of kids that are really hurting, a kid that was abused that maybe we could have prevented, a kid that's maybe hungry, or a kid, you know, and I know that, you know, Clayton said we're going to feed the kids and all that, do all that, but there's nothing better than being in school. There's nothing better. And absolutely, if we don't watch, we're going to awaken to a situation to where last spring we lost the spring, and now we're going to lose the year. And absolutely, we're going to awaken to a situation to where, man, we got a gap. We got a break in the chain of our children that they'll never recover from if we don't watch out.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I know you said there are a lot of details left to be determined about it, but could you comment on where we stand on the map now? So it sounds like the only people that need to pay attention to the map after we go back are high schoolers, and the only color they have to pay attention to is red. Is it going to have any, bearing on sports for middle schoolers? Thank you.
Charles, I don't know the answer to that. There's a lot of work that still has to go into that and everything. I think our map has served us well and everything up to here. It's served us, it's surely erred on the side of safety. It's surely done that. And if we in West Virginia are alarmed or concerned about 1,318 people that are dead and all the situations that we've had across our state, I can promise you beyond any doubt whatsoever that if we would have treated our map in a different format and everything, it probably would have been worse. And so now we know a whole lot more. We know an exceptional amount about our young kids and everything. We can do stuff there. As far as our sports, we know sports are much different than going to school, in the setting, because now you've got people that are traveling, and you've got people that are coming to games, and you've got all kinds of interaction and everything that causes us all kinds of potential problems. So there's still more to be worked out there, but really and truly, all the science tells us now that really the kids that are under middle school and under, probably one of the safest places that they can possibly be is at the school. And we know the benefits. And so with all that being said, just think about what today is. Today is probably one of the last official days of the Christmas vacation, is it not? And we have got to give people, plans and definition of where we're going to go. And so with all this, I think we've embarked on a bold plan. There's no question about that. Nobody needs to be blamed for the boldness of the plan. If the plan, if the plan fails us, but right now we're failing in lots of ways. We're failing by our kids not being in school and all the bad things that are happening there. Now, I caution everyone, I want everyone to hear me loud and clear. There's no way to remove all the risk. There's no way to remove all the bad waves in the sea. Right now, we are in a pandemic, and we are absolutely having to deal with it the very best we can deal with it. I have no power to calm the seas, but I can absolutely tell you that this is the best thing that we can possibly do to minimize the effect and be as risk-free as we can be.
All right, thank you, Charles. Next to David Beard with the Dominion Post.
Hi. I think Dr. Marsh and the governor just now touched on this, but I wanted to kind of get a fuller clarification on why the Red County high schools won't be included in the January 19th reopening program. Thanks.
Dr. Marsh, maybe you can answer that. I don't know that I quite heard it, but did you get it, Doc?
I did.
Okay, maybe Clayton, and you can
Okay.
answer that.
Yeah, thank you, David. Well, what I mentioned before, and the governor mentioned as well, that there is really compelling data that's come out of our schools that basically says if we follow all the mitigation measures, that transmission in classroom is very rare through all of the classes. But what we know from a big study in Iceland is that children 15 and under are much less likely to catch and to spread. 50% is likely to catch, 50% is likely to spread as children who are over 15 years old. And there may be several reasons for that I, at some other time could talk about. But for the purposes of this conversation, then there does seem to be a difference in the innate abilities of COVID-19 to infect and to be transmitted through kids less than 15 years old, 15 and under, versus those that are over 15 years old. It's also been seen in other countries and in some of the US, including data from Utah, that middle schools are less likely to be spreading areas than high schools, and that elementary schools are less likely to be spreading areas than middle schools. So it appears that as we just look at transmission in general, and this can include community transmission, not in-school transmission only, but super spreader events are very rare in elementary schools, are rare in middle schools, and at least as far as the world's experience and some experience in the US, if there is a place that we've seen more, it's in older children and high schools. And that includes the socialization, parties, and other things that kids are going to. So it's not all in class or in school, but I think it does start to separate the high school age kids that we just have to be a little bit more careful about because of their ability to both get infected and spread COVID-19 perhaps more readily than younger children, 15 and under. And this to me is also being very careful because we know that our high school students also benefit from being in school, and we want to get them back in school, but we want to make sure this is safe for them and for our teachers and from our staff and other folks. So Clayton, I'll turn it over to you.
No, thank you, Dr. Marsh. That was a great answer of the why. And to kind of just clarify, when we lead up to January 19th, that is correct, that we will ask that all of our pre-K through 8th grade, our elementaries and middle schools, come back in person, and that our high schools at that time will all come back in person if orange or better. So those that are red, whatever that's defined as, would be remain on remote.
All right, thank you, David. Next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. First of all, Governor, maybe you'll do this in your closing remarks. I know a key member of your staff is retiring this week, and we hope to hear some words about him. But here's my question, and this is honest to God, a serious question. I ask it in all sincerity and respectfully because I think it's an important issue to address. And it's about the importance of finding every now and then a little levity, a little chuckle in all of this darkness and tragedy we're in the midst of. And I ask it because there's a picture widely circulating now on the internet of you holding up a batch of cookies from the Rock City Cookie or Cake Company here in Charleston. And everybody's getting a chuckle out of this because the cookies have all your quirky sayings and folksy sayings like clear as mud and go to Bob Evans and wear the egg-sucking mask in every way, shape, form, or fashion. I guess my question is, do you think it's important that we find moments to laugh and chuckle in darkness? And also, does it help promote small business? And my understanding is these cookies are selling like hotcakes, pardon the pun, all over the state. They have them down at Tamarack and places all over, and it's really catching on. And talk about the importance of promoting small business and having a little fun in tragic times sometimes.
Well, Mark, I appreciate you saying, have some fun, because I truly believe that the good Lord gives us the ability to smile and to laugh. And when they brought those cookies over to me and everything, and it's just, if you can't make fun of your own self in this world, I feel sorry for you, because a lot of my sayings are pretty bizarre, and it is kind of I thought it was really hilarious, to tell you the truth. But and the other thing is, I'm tickled to death to support any and all of our small businesses any way I can, because they've really been hurt bad by this, and I don't know how their cookie sales are going, but from the standpoint of it being funny, I thought it was funny, and I love people kind of jabbing at me, because I love to tease myself, and I can surely take it. So I thought it was good.
All right, thank you, Mark. Next to Katie Coyne with the Charleston Gazette-Mail.
Thanks, Governor. I want to push a little bit. I know I asked about this on Monday, but talking about our jail populations, with what you said today with corrections staff, only about 60% expressing interest or opting in for vaccines, and with the unknowns that we have about transmission even after being vaccinated and the cases that we're seeing today, I want to ask again, when will we be looking at bringing vaccines to those who are housed in our jails and prisons, and why aren't we seeing that as a priority right now when other states are, and as the spread continues to grow there?
Well, I don't know really and truly that I have the information enough, and I don't dodge any question, but I don't know that I've got all the detail enough to tell you anything other than just this. What other states are doing, they're late to the party, are they not? I mean, really and truly, what our corrections people have done, oh my God, living, compared to the other states, well, they've almost pitched a perfect game. I mean, so I could give a hoot about the other states in a lot of different ways. But when it really, really boils right down to it, I want to care and do the most at all times for all of our people. We do need more of our staff that are taking the vaccine. There's no question about that. I need more information, from corrections and everything, because any place and every place can get really bad and get really bad quickly. And at the end of the day, we don't want anybody disadvantaged in any way. And so I think our people have done a whale of a job, but it's just like what we're doing now with this program that we're announcing today all across our state with our schools and our seniors that are above 80 and everything else. It only matters just this is, so we're doing good, let's do greater. And from the standpoint of our corrections, so we're doing good, let's try to do greater. But I'll get more information and be able to report to you on that as quickly as I can.
All right, thank you, Katie. Next to Paul Mullen with WCBC.
Good afternoon, Governor and panel. Happy New Year, everybody. Governor, you've made a point today, and you've said it before, that remote learning is failing. I think Superintendent Birch has said that as well. My question goes to the kids that are in the system. How do we get them caught up? How do we make sure that they've gotten the education by the end of this year that they deserve to have? Is there a plan for evening high school, summer school, advanced tutoring? I don't know where we go from here.
Well, Paul, I appreciate the question. I love the question, really and truly. And to be perfectly honest, from my standpoint, it's going to be really difficult to do. But Clayton, I don't have the answers. And Clayton, you're going to probably have to elaborate on this a lot better than I. But you got to remember, I have been in the schools so much, it's unbelievable. Now, not here as of late, but I see what's going on in our schools. And I see the shortcomings, but I see overwhelmingly a tremendous amount of goodness that goes on with our teachers and the interaction with the students and all that. And I see how our kids learn and everything. And I mean, I'm there. I'm just not on the sidelines, I'm there. And so this gap is going to be really difficult to recover as quickly as what you're thinking. And the other flip side of it is, if we don't stop this gap from widening, it's going to be impossible to recover. But Clayton, go ahead.
No, so thank you, Governor. I think you started off very, very well, because that's exactly it. What we're announcing today is the first step in mitigating the continuation of that widening gap. The governor's correct. He's been in the schools. I've been in the schools. We know that our teachers are paying attention to what's working, what's not. And, probably best to answer the question is what I heard a group of 3rd and 4th grade teachers in Ohio County tell me. And they were a wonderful, wonderful group who have done everything they could to try to make remote as beneficial and as engaging as possible. And what they told me was this: if we can get them back to us on a regular, consistent basis, we need to really, really pay attention to what's most important. We're going to have to really be prepared to nurture these children when they come back. We've already heard the governor and DHHR talk about, we don't know the trauma and the social emotional issues some of these children have faced. They were not wired to be alone. Are we going to ask our teachers to try to close this achievement gap and some of the learning loss? We're also going to be asking our teachers to be that one caring adult that's going to have to be prepared to assist these children coming back to school on a consistent basis. The governor's correct. We have a lot of work to do. We now have an opportunity to really focus this spring and leading into the summer. We have a lot of work to do leading into 2021. It's not going to be a quick fix to catch everybody up, but we are going to work, and we're going to trust our professional teachers. They know their children. They've been trained to do this. They know how to personalize learning, and we know that we have a lot of work to do. But again, I think today is one of the first steps to mitigating that widening gap.
All right, thank you, Paul. Last question today from Taylor Stuck with the Herald-Dispatch.
Hi, everyone. This is Taylor. I understand that it's hard to say when a certain group might be in line for the vaccine because we don't know when we'll get more vaccine. But for those people who are waiting, say grocery store workers, people in retail who are in front of the public, they're anxious to get it. How will they know when they can get the vaccine? Who will reach out to them? Will they get a call? Will it be their employer? Just for those people who are anxiously waiting, what can they be looking out for?
General, I think you've got to answer Taylor's question, please.
Yes, sir, Governor. So, Taylor, we are working through the Joint Interagency Task Force with various associations, with licensing boards, other organizations. So, what will occur as those over 50 in the essential workforce are identified, then they will be reached out to through the employers. We are having those organizations build the list for us. So a lot of work has to go into it. We will make sure that individuals get identified, as well as with the 80 plus population and then 70 to 80 population that the governor mentioned, working with local health departments, with the clinics, with primary care docs. We will be working that outreach, and then we'll do multiple additional outreaches going forward. And the last thing I'd say is you brought up a good point, when they are available. The governor is pressing us to get vaccines out as quickly as possible. At the same time, we are managing the fact that CDC this coming week will have reduced our allocation for the second time. So we are pressing hard, and the governor is screaming, and he's got me screaming. So these folks are saying West Virginia can get the shots out and get them in arms, get us more doses.
All right, thank you, Taylor. Governor, back to you.
Well, I'm going to conclude today, a little differently. I'm going to thank, like I said, a great general that just spoke, a great Clay Marsh, a great Dr. Amjad, a great Secretary Crouch, all the different people that have put in all the licks and everything along the way. They've done a heck of a job. They really have. And it's been a real honor being with them and getting through all this. And we're going to continue to fight in every way we possibly can for all of you. If I forget somebody along the way, please forgive me, because I surely don't mean to do that. There's so many people that are out there on those front lines that are absolutely making life better for each and every one of us, and doing it in such a courageous way, it's off the chart. They get up, like I said, every day and take a shower or whatever and get dressed and know they're going right to the fire. Right to the fire. As they kiss their kids goodbye until they see them in the evening and whatever like that, they know they're going right to the fire. We love them, and we really appreciate them. And I ask so much in each and every day that you not forget 55 that I read today. 55 and 1,318 West Virginians. You got a lot of great people that are really, really pouring it on. And nobody's in it, and I hate to say it, but I don't really care if we're tired. I appreciate it and everything else, but none of us are going to quit until this is over. So thank you all so much. I appreciate every last one of you in every way. And God bless all you great West Virginians.